Brooke, can you enable screen sharing and I'll show the epidemic curve?
Okay, try now, please.
All right. Is that working?
Yes.
Okay. Welcome, everybody. This is the epidemic curve updated today for Scott County. The curve for Rock Island County is essentially the same. The numbers are a little different, but essentially the same. We've passed 26 cases per 100,000 per day in Scott County, and that's 13 times the best we did on 2nd or 3rd of July. Test positive rate is 13%, 14-day average. It's actually higher than that now, but 13% over the last 2 weeks, which is 10 times the rate on July 2nd or 3rd before the holiday. So I think you can see from the shape of the curve at the far right, we're going the wrong direction. Again, more than 10 times higher than where we were. You'll hear more about hospital admissions that have increased markedly nationwide, and you'll get a feel for local numbers from Kurt and others on the call. Clinical capacity has already exceeded Florida, Texas, across the Gulf Coast generally. We're not there yet, but we're getting close. There is relatively new evidence that immunized people are having breakthrough infections. It's gotten a lot of media coverage. I want to make just a couple, 3 points about that. Breakthroughs are both expected and important. The current evidence says that vaccination during Delta reduces the risk of infection, presence, and multiplication of the virus by 50 to 60%. That compares to above 70% for the prior variants. So we're seeing more breakthroughs, but the vaccines are still very effective. The large majority of vaccinees who have breakthrough will not get sick or require care, and the large majority of nationwide hospitalizations, ICU admissions, and deaths are in the unvaccinated. Delta is the current variant. It's not the last. And we need to think in those terms as we develop our ongoing responses. While the emergence of an individual variant is not predictable, we do know that the more infections occur, the more variants will arise. That's one of the reasons that horrid epidemic curve makes us so nervous. Immunization, which continues to substantially reduce infection rates, is the best way to prevent emergence of variants.